Welcome to Brainthropology. Let's talk about our amazing brain and the issues that get us stuck. We all have those moments where life gets overwhelming. It can be related to injury or illness, or an issue with your kids, or just because life is crazy and we need a little help and encouragement. Our team of therapists, expert guests, and clients are here to deep dive into the topics that matter most. We will share information with our listeners that encourages, educates, and empowers. We discuss and provide practical tools and strategies to change lives. We invite you into our community. But be prepared. This listener community is built through vulnerability and might at times be raw and emotional. We are here to provide free hope and support to those who need it most.
Hello, everyone. Welcome to the Brainthropology podcast. We have such an informative show planned today. I am your host, Debbie Loftus, and we're very excited to have clinical psychologist on with us today, Judy Malinowski. If you haven't listened to our last podcast, you might want to tune into that first, as we had an introduction to the topic of trauma. And today's podcast is about the treatment of trauma. And we were so grateful to have somebody in studio with us that's an expert on this subject, Judy Malinowski, to talk about it. Before we get started, we always like to encourage people to start their day with gratitude. And one way to do that is sharing a personal or professional positive. I'm going to share with a funny little story. Before we started this podcast, I had a wonderful, awesome cup of coffee with flavored creamer, and I spilled it all over the entire table. So today I am very grateful for paper towel and the ability to clean up things very quickly so we could move on with the podcast. But my personal positive, I am grateful for sports. So I know that sounds kind of crazy, but my son plays high school and club soccer and indoor, and I am just so grateful to be able to go and see him play and see the smile on his face. And my daughter played as well in high school. And it's just such a positive experience in my life. I love looking forward to their games, and I know I'm going to miss it soon when they both go to college in the next year or so. Yes. So that's mine. What about you, Judy?
Well, I'm really grateful because in less than 7 days, my husband and I will be heading to Florida for a couple of weeks to spend time with his family. And I am so looking forward to sunshine and sand and beach and water and tropical everything.
Oh,
so
that's the best.
Looking forward to that.
Especially in Michigan winter.
Absolutely.
So it's a must. All right, so let's dive in. So Judy, thanks again so much for being here today. I think the best thing to do initially would be to give a quick review of defining what trauma is. So in our last episode, we defined trauma as the lasting emotional response that often results from living through a distressing event. So when I researched these two episodes on trauma, I found that the general consensus was that experiencing a traumatic event can harm a person's sense of safety, a sense of self, and the ability to regulate emotions and navigate relationships, which is so important on our day-to-day basis in living life. The effects can be long-lasting, but it's very important to know that healing is possible. And through recovery from trauma, although recovery from trauma is not easy, it is possible. So we talked about that many people who have experienced trauma find it difficult to practice self-care. And this is really meaningful to me as an occupational therapist because we deal with this when treating clients. We go over their self-care regime. And also how important it is to give yourself self-compassion. So trauma therapists can work with you to boost your skills in these areas, which can have lasting effects on so many areas of your life. As you seek to identify, define, and explore what trauma means, remember to have self-compassion, because learning about trauma can be a real challenging process. And I'm really hoping that this podcast helps with that process. We know that trauma-focused psychotherapy is one of the most effective things that you can do for recovery. And I've kind of heard the gold standard for treating PTSD symptoms is psychotherapy, particularly cognitive behavioral therapy, cognitive processing therapy, and prolonged exposure therapy, which sound like very big words, I know, but we're going to dive into that today. And also EMDR, which is eye movement desensitization and reprocessing therapy, which we'll give a little bit of a definition for, is also shown promise in helping people recover from PTSD and traumatic experiences recovering from. I know a few other therapies for trauma, like I said, CBT, prolonged exposure therapy, EMDR, narrative exposure therapy. And excuse me as I change the page of my dripping wet notes here. So if you're watching this on YouTube, you'll be able to see that. If not, you can just visualize the pages that are stained with coffee. It smells really good in here, though. So, Judy, can you tell us about some of these treatments that you have found most effective?
Well, I think the word that you used in numerous one of those different types of therapy is the processing. So if we think of the brain is almost like a computer hard drive, and how it processes memory, how it processes emotions, how it processes experiences, it's very important to realize that if I'm exposed to trauma, either through my own personal experience or through witnessing it, it will impact how the processing of the event is. But not only that, but the processing of who I am in relationship to that event. And that's what the unraveling that we do in trauma therapy is all about, is understanding, again, you're not trauma. Trauma happened to you. The event happened to you. You either witnessed it, you were involved in it, whatever the case. And so we have to be able to disconnect that ideology that I caused this, I'm damaged because of it, I'm never going to get well because of it. I'm all of those different stories that we make up about ourselves in relationship to the trauma.
That's so important.
Right? So when we look at CBT, which is cognitive behavioral therapy, cognitive is your thinking. How do you look at the world? What do you think about? What are your thoughts about yourself? This is probably the core issue of really looking at trauma therapy is how do we help you to change the way you think about yourself in relationship to the trauma? And so you can say to yourself, I'm not damaged. And that is such a huge piece of this for people because they go through the world thinking that there's something wrong with them.
And that other people view them that way as well.
And other people view them that way. And then what's very frightening is that they destined to repeat that experience over and over again through self-fulfilling prophecy. I'm damaged, I'm worthless, I'm not good enough. So then I either engage in behaviors that reinforce that, or I cause and attract other people in my life to reinforce that. And so we look at that and say, okay, how do we break that connection?
Yeah, that's so important. So in talking about trauma, I have heard a model called Herman's model of trauma recovery. And I found it really interesting. It's a 3-step process that's widely accepted by trauma specialists. And it was introduced by Dr. Judith Herman in the book Trauma and Recovery. And we will have a list of some great resources in the show notes today. And this is one of them, Trauma and Recovery. And the model is based on the idea that healing from trauma can't happen alone. So it can only occur within the context of connection with other people. So based on this approach, the steps of trauma recovery include stabilization, reprocessing, which you mentioned before, and reprogramming. Can you describe in detail those 3 processes?
Well, stabilization, in a sense, is being able to stabilize the emotional reactivity and learn emotional regulation. So if I'm being flooded with my emotions, whether they're anxiety, terror, depression, hopelessness, helplessness, whatever the case may be, I cannot access higher levels of cognitive processing. I just don't have the means to do that because I'm flooded. So if you think of a tsunami, or if you think of the waves that come in that completely overwhelm the person. Mm-hmm. So we have to be able to stabilize that first. We have to help the person allow themselves to calm themselves down. That's why it's so important that it's not done by yourself, because you're not going to be able to solve the problem at the level that it was created. You need someone else to show you the pathway on how to get out of that and be able to help calm yourself down. So there's the stabilization.
And on that same note, before you go on, it's interesting talking about the brain and the frontal lobe.
Right.
So that frontal lobe is so important in trauma therapy.
So for those of you that are watching this on a podcast, I want you to be able to think about when trauma hits us, it hits in the back of the brain, the back where the limbic system is, the amygdala, the hippocampus, the hypothalamus. when we are processing, when we're learning to calm ourselves down, what we want to activate is the prefrontal cortex. So we want to take it from the back of the head to the front of the head so that we can bring ourselves into gaining understanding of all the consequences and connecting the dots, I like to say. So that's the reprocessing. I want to develop new neural pathways that break off this idea that I'm a victim, or I caused it, or I'm damaged goods. So I want to be able to pull that and reprocess that and reorientate myself in my identity. And then the last piece is the stabilization. I've got to be able to continue to work on that, because this is not a one-stop thing. This is not, I'm going to go, 10 easy lessons and I'm going to not have trauma anymore.
Right.
Someone really does need to make the commitment that this may take some time for them to be able to move through these stages. The first and most important stage of this is being able to connect with a experienced, informed trauma therapist that can help you go through this. And you're going to build trust with this person. You're going to build a relationship with this person. And so that may take some time in as well.
And so the final stage would be that integration.
Correct.
And establishing a reconnection with ordinary life.
Exactly. And that's what we're all looking for, right? How do we live in this world? How do I interact in this world in a different way than I interacted before?
That's so important. So it's important to know that everyone responds differently to trauma and therefore to trauma therapy. What works for one person may not work for another. In other words, there's no one-size-fits-all approach to trauma therapy, but that's why it's so important to find an experienced trauma therapist, as they can identify what most likely will be best for you, what type of therapy. We talked about CBT some in the last episode, but when researching trauma, I found something called TF-CBT, which I found interesting. It stands for Trauma-Focused Cognitive Behavioral Therapy. So in doing the reading before this podcast, it is an evidence-based treatment for children and adolescents impacted by trauma, as well as their parents and caregivers, which I found so functional as a therapist to integrate the caregivers. And research shows that TF-CBT successfully resolves a broad array of emotional and behavioral difficulties associated with single and multiple and complex trauma experiences, which we talked about in the last podcast. And early trauma can lead to guilt, anger, feelings of helplessness, powerlessness, self-harm, acting out, and depression and anxiety. And that PTSD, which can affect children and adults, can manifest in a number of ways, such as negative reoccurring thoughts about the traumatic experience, emotional numbness, sleep problems like you discussed before. And by integrating the theories and techniques of several therapeutic interventions, it sounds like TF-CBT can address and improve the symptoms of post-traumatic stress in youth. So I want you to talk about some of the core features of it. So can you talk about some of the treatment strategies? I know one of them is psychoeducation we talked about before, but I'd love for you to dive into that.
Well, one of the first steps is learning how to regulate your emotional state. So if I was working with an adolescent and they tended to get flooded with anxiety, terror, all of those different things, I am first going to work with that individual on how to calm themselves down. What are some of the things that you can do? Is it through deep breathing? Is it through could be meditation, could be journaling, could be a lot of different ways to calm that central nervous system down.
It sounds like coping skills.
Very much so,
okay.
Right? But we're dealing with, if we're focusing on youth and adolescents, we have to understand that they don't know what coping strategies are necessarily.
I wish that was a class in high school.
Exactly.
I really do.
To me, it should be all the way right from preschool.
Yeah.
Right? How do we calm yourself down? Center yourself, doing those types of things. And a lot of times parents are great with this. It's like, okay, take a deep breath. That's, to me, when I look at that was what a timeout. When I was raising my children, what was the purpose of a timeout? To calm yourself down. It wasn't a punishment. It was more of a reset.
Kind of regrounding yourself.
Exactly. So that's one of those things. And to be very, you've got to try everything. That's one of the things, too. We can get kind of narrow-minded when we're thinking about what's a healthy coping strategy or what's not one. we have to find what works for that individual person. Maybe they're far more physical, so their way of really being able to calm themselves down is doing something much more active. So we bring that in. The second piece is really the narrative, is the psychoeducation. I apologize. It's really about educating individuals about what trauma is and what they can experience or what they have, giving people a language. It's very important to understand when we're defining terms that if we're not on the same page on what somebody means, we're going to go into a state of confusion.
Knowledge is power.
Knowledge is power. And I'm a huge proponent of psychoeducation. I think for most people, they're very interested psychologically and want to be educated as to why they do what they do. That's the number one question in life, by the way. Why do we do what we do?
Right.
Or the second question, why did they do what they did?
For sure.
So those two things. So we have the emotional regulation and the calming. We have the psychoeducation so that they can engage their cognitive ability to think and to understand. Then the next piece is called the narrative or the story. So when we're dealing with children especially, adults can write their story out, and I will tend to take an adult through, give me one episode, one memory, knowing full well that that memory could trigger up other memories, but we're really going to get specific, and we're going to be, it needs to be detailed. You know, what did you see? What did you smell? What did you feel?
The senses.
The senses. Because so oftentimes in trauma, we don't realize that we may not have visual access to the memory of the trauma, but we could have olfactory. We could have tactile. Maybe my eyes were closed in the middle of a traumatic event, but I smell something.
And that could be a trigger.
Absolutely.
Yeah.
100%. That's oftentimes when, you talk about what if a person doesn't know they've been traumatized, but the next thing you know, they smell cigarette smoke, they smell alcohol, and they get triggered.
And they go to that fight or flight.
So we want to get into the narrative, the story, and what is the process. The person writes their story, or in terms when they're dealing with children, young children, we may have them draw the story because they may not have access to the verbiage, to the vocabulary in order to put the words to paper. And then it's about reliving that. And I know this might sound more traumatic to the person, but we have to take you through the story enough times for you to realize that it is now a story.
And you become desensitized.
And that's what it is. And then bringing in parents or caregivers or someone who is close to hear the story. Because oftentimes parents may not have access to what that child or what that adolescent or what that other person has gone through. So that's very important to have that.
Oh, that's so interesting. So just a little recap of that. So for the trauma-focused cognitive behavioral therapy, some of the treatment strategies within that are psychoeducation, coping skills, gradual exposure, cognitive processing, and caregiver involvement. Can you talk a little about the caregiver involvement?
Like I said, oftentimes parents or caregivers may not be aware of what the individual has gone through. Mm-hmm. So for them to be in a safe environment, because that's another aspect. Oftentimes individuals who've gone through a traumatic event don't tell other people. They may not want a burden. They may not believe that they're going to get the kind of support they need. They could have been told, if you tell anybody, I'm going to hurt you or I'm going to hurt them.
So it goes back to that safety again.
Absolutely. And so when we bring in a caregiver to be able to hear the story, it's not to say, why didn't you know that this happened? It's to say, this is what happened. Mm-hmm. And so we're going to do it in a safe environment so that the individual who's experienced the trauma feels like they have an advocate, but the caregiver also feels like they're not being blamed.
That's so powerful. So it sounds like the goal of the treatment in trauma-focused CBT is to help the patient develop a sense of safety, security, to repair or develop healthy social skills, and for the caregiver to feel more confident in their ability to help the client in a productive manner.
Correct.
So now that we've talked about the more common treatments used to treat trauma, let's talk about some alternative therapies for trauma. So complementary and alternative medicine are becoming more widely accepted in Western medicine model, which I love. And some examples and, big words when we talk about complementary and alternative, but I'm sure you recognize some of these. So acupuncture, deep breathing exercises, meditation, progressive relaxation techniques, and also some reflex integration, which we've talked about before, and Galaxy Brain and Therapy Center offers some really neat different treatment options that go along with these complementary treatments for trauma. What would you say, Judy, do you have any examples of how alternative treatments can make it more effective in treating trauma?
When I was engaged in a great deal of trauma therapy many years ago, I worked with a massage therapist, and she was aware that the individuals I was sending to her had gone through trauma. Mm-hmm. And so she would work on body work safely, safe touch, being able to release those stuck emotions that we can hold into our bodies. Mm-hmm. We can hold them in our back. We can hold them in our chest. We can hold them in a lot of our cranial sacral, so many different things that we can hold. And she would work with them on these different body, sections.
Yeah.
And then if they had a memory, they would then be able to journal out that memory, bring that back into the session with me, and we could work it out.
That's so powerful.
It was very powerful, and there was a great deal of healing that occurred through that collaboration that I had with her.
Yeah, I don't think people realize that physical manifestations come out of emotional issues.
Absolutely.
Yeah. So along with complementary methods, it's important to maintain a balanced lifestyle. So as an occupational therapist, we focus on this, and a lot of times we go over healthy lifestyle, some different strategies. So we want to make sure people are getting between 7 and 9 hours of quality sleep every night. People don't realize the effect of sleep on the brain.
Well, that's interesting because, again, I work with a lot of first responders who may be on shift work, who may have interrupted sleep. And they don't realize that if they're not getting that deep stage 4 sleep, they're not recharging their batteries.
Yeah.
And for most of us, we know that if we have that interrupted sleep, we're up at 3 o'clock or up at the certain times of the day, or in the evening, it really impacts us.
Yeah, and you're going to work at a 6 out of 10 instead of a 0 out of 10.
And we wonder why we're distracted. We wonder why we can't think correctly. Our focus, attention span, concentration, health. Mm-hmm. Not enough sleep impacts our immune system.
Yeah, for sure. Another area is eating a diet that contains plenty of nutrient-dense food. So this is so important, having your omega food. There's just so many foods that are so healthy for your brain that we like to educate people on. And
I'm glad you used the word nutrient instead of caloric.
Yes.
Because there's a lot of caloric dense foods that are not nutritious.
For sure. Also, as you mentioned before, it's always a good idea to save some time for relaxation techniques. And now with the internet and different apps, there's so many things available that people can Google, and you'll have 5 free apps at your fingertips that will take you through a guided meditation. Do you have any apps that you would recommend?
I use Insight Timer.
Okay.
Pretty extensively because I just think it's easy to access. It's got over 10,000 different guided meditations. But the other one I like to use, his name is Dr. Joseph Dispenza, D-I-S.
He has a great TED Talk.
Yes, he does. Yes, he does. And he does a lot with rewiring. He's a psychoneuroimmunologist, and I love how he utilizes meditation and sound. That's another alternative way to help rewire the brain. If you think of the brain as being a neural network of fibers and pathways, we need to rewire.
For sure. So it's also important to remember that living with trauma, it can be painful. So I know when people come to a therapist initially, they are in a lot of pain, and it's an isolating experience, but you don't have to go through it alone. So I just want to make sure listeners know that treatment is available and recovery is possible. And it's also important to mention, if you're considering self-harm or suicide, that you aren't alone, and to know that help is available right now. And I always want to mention the crisis hotline, such as the National Suicide Prevention Lifeline. And that number is 1-800-273-8255. And you can also, now you can text the word home to the crisis text line at 741-741. And we'll put that on the show notes as well. So, Judy, what would you say were the most helpful resources that you have found for your clients related to trauma? Whether it be books or podcasts, or, I mean, you just shared a couple apps as well.
Right. And the book, I think that I've been hearing, I read it a couple of years ago, is The Body Keeps the Score. Mm-hmm. And it's so funny because I had a couple of clients come in and say, I think I've been traumatized. How do you... And it's because they picked up this book at a local, big box store or something, and they thought, wow, that's what's going on. And so you can Google, just go onto one of the search engines to find different, and just put in trauma, and you'll be amazed at what will show up. There's numerous publications. And so it's one of those things of what fits you, what would fit your needs.
And also, it's important to know that even on Amazon, you can just Google things like this and workbooks will come up. When I was researching this, there's a couple different workbooks. One of them was called the Complex PTSD Workbook by Ariel Schwartz. There's a book called Trauma and Recovery by Judith Lewis Herman. And it's so easy now to have access to that. Yes. So that is one of the benefits of the internet. There's a lot of negatives, but that is one of the benefits of technology.
And that's that part of the psychoeducation. Educate yourself.
Absolutely.
And I'm a firm believer that when somebody says, I'm going through something, one of their major issues is that they feel so isolated and alone. They feel they're the only person that's gone through it. Well, if there's over 1 million books in print that are addressing their issues, you're not alone.
Right.
Somebody else has gone through it. How do I know? They've been writing about it, and people have been buying the books. So that's another aspect. Just because when we're alone, we tend to not address our issues because we don't think anybody's going to understand. People will understand.
And there's support groups out there too.
Absolutely.
Yeah.
Absolutely.
Is there anything else that you wanted to mention before we close about the treatment, about, with trauma and anything that we've talked about during the podcast?
I think it's always important that if you are experiencing one of two things in your life, distress or dysfunction, seek help. You don't have to go through this by yourself. You don't have to keep repeating the mistakes of the past. You don't have to suffer in silence or by yourself. Seek help.
That's so important. And know that if you've experienced trauma, try to go easy on yourself. Give yourself grace. You've been through a lot. Consider taking the time that you need to feel what you need to feel and go through it instead of suppressing it.
Absolutely.
If anything, that's what I've learned. You can walk the healing path one day at a time and know that there's always hope for a better tomorrow. So, Judy, thanks so much for joining us today. Listeners, we hope you found this podcast helpful. If you think any of your families or friends would benefit from hearing it, please share the episode. Feel free to check out other episodes at brainthropology.com. And as always, we encourage you to be courageous and move forward in your day with hope, joy, and purpose.
While we love what we do and are as passionate as they come, the information on this podcast and discussion is for educational purposes only and should not replace professional medical advice. Please consult your own healthcare provider if you are seeking medical advice, diagnoses, or treatment for you or anyone else. We do our very best to provide correct information, but please understand science and medicine is ever-changing. We welcome feedback, comments, suggestions, or correction of errors. This disclaimer applies to any guest or contributors to the podcast or blog.